All right, guys. So for this lecture, we're going to take a little bit of a look at some of the conditions that can happen because of problems with the pituitary gland hormones. Okay. So one of the first ones that we can see is with the growth hormone or the GH hormone. In normal conditions, this is what allows us to reach our normal size, shape, and dimensions. But the problem that can happen is there's a couple different things. So we can have hyposecretion. So hypo means under secreting this. And if that happens, we end up with an individual who has dwarfism. That is characterized by slow bone growth, obviously. The epiphyseal plates, the ends of the bones, the growth plate essentially, closes before this individual reaches normal height because there's no secretion of this growth hormone. The only way to treat this is to supplement that growth hormone therapy and inject these people with GH. We have to do that before those growth plates close, because if they close, then no growth will happen after that. But that's the best way to kind of treat that. There are some other ways to treat after the bones have stopped growing, but it's much more painful. They actually have to break the long bones and cause the long bones to increase while they try to heal at the same time. Right? They can also have hypersecretion. So this is oversecretion, which causes gigantism. So in these cases, you see people with very long, abnormally long bones, and they tend to be much taller for their age than what they should be. Okay, so those are the two big things: hyper and hyposecretion. So hyper is above normal secretion, hypo is below normal secretion. But in both of these cases, this happens before long bone growth has ended. Okay. Another one that we can get is after long bone growth has ended. So people can have what's referred to as acromegaly. So this is hypersecretion of growth hormone after their epiphyseal plates, their growth plates have closed. So in this case, what we happen to see is growth actually doesn't stop. These people continue to grow, but they don't continue usually to add in height. What they tend to see is the bones of the hand, feet, cheeks, and jaw. Those are the parts that tend to start to grow. So we know that this is a picture of Andre the Giant, actually, and for the Princess Bride. We know that he not only had hypersecretion of growth hormone before his long bones closed, which is why he was above 7 foot tall, but we also know that he continued to have hypersecretion after his long bones had actually stopped growing. So they get this very thick, kind of very large hand. This is another pretty good picture of this. So they get this very pronounced eyebrow ridge, all right? They get these very pronounced cheekbones and usually a very pronounced jawline, all right? This kind of rounded jawline is created because of this. And then they usually get a lot of this kind of abnormal soft tissue growth. So it has to kind of fill in these spots because the bones themselves continue to add size. Okay, you can see the difference here between a normal hand and a person with acromegaly. All right, there's not much difference in size of the hand, with the fingers width-wise because of the additional bone growth and soft tissue create that. Okay, a couple other hormones that we tend to see an issue with here with the pituitary gland are the FSH and the LH. And in most of these cases, what we see is hyposecretion. Hypersecretion really wouldn't cause anything to happen here. But hyposecretion of both of those hormones could cause a person to be sterile, meaning they would not be able to have children, so they would be infertile. And that's mostly just because there would be an underproduction of both the testes in males and the ovaries in females. And then because of the FSH, all right, there's underdevelopment of them, and then the LH is what really causes the production of both of them, the egg cell as well as the sperm cell. If we have hyposecretion of both of those, then we just don't have anybody that can have kids. Okay. All right, the last one with the pituitary gland that we usually see is an imbalance with ADH, this antidiuretic hormone. Okay, so if we have hyposecretion of that, right, hyposecretion would be not enough of it, so these people would have to go to the bathroom a lot. They would get what's called diuresis. All right, it's constant urination. They would also be dehydrated because their body's not reabsorbing any of the water in their kidneys that they normally should reabsorb. And because of that, they usually are constantly thirsty. So usually what you'll see is a person who has to go to the bathroom all the time. They're constantly dehydrated. Their skin can be dried out. They could have dryness of their mouth. They could have issues with memory loss and things like that. Muscle cramps is another big one that we tend to see with that. And then we have people that are very thirsty all the time. Treatment is pretty easy. Well, easy in terms of most of these other ones. There's actually a nasal spray that contains ADH that we can give these people. All right. This is usually classified as diabetes insipidus. Insipidus means constant thirst. All right. So people with diabetes insipidus, they're constantly going to the bathroom and they're constantly thirsty all the time. Okay. It has a huge link to both type 1 and type 2 diabetes because of the loss of water. Usually, when we're losing water, we're also having issues with our blood sugar concentrations at the same time. Okay. All right. We're going to go ahead and stop there with this lecture.